The most important way to determine if a patient needs revision spine surgery is they've had a previous spine surgery. And typically that previous spine surgery either didn't work in the way that they expected, or the patient continues to have symptoms that were not relieved by the previous operation. So the process for planning a revision surgery is arguably the most important step. First thing we do is we get a full-length x-ray looking at the patient's spine from the base of their skull all the way down to the middle of their femurs. This allows us to make a diagnosis of what their spinal shape is like. Then we obtain MRI scans and CT scans, whatever is clinically relevant. And then we actually input all of this into an AI system that allows us to simulate what the effects of the different surgical techniques would be and allow us to ultimately make the decision for what type of surgery we're going to perform. A patient's previous response to surgery can be very important. For example, if the patient had the right surgery but did not have the correct outcome, you have to ask yourself, is it an issue of the surgical execution, or was it potentially the planning in the first place? There are also situations where there can be patient-specific factors that can influence the outcome from surgery, either medical issues or other types of things that can have a big impact. So patient positioning is very important because often this can help us to dictate how much correction we can obtain during a revision surgery. The most common position is prone, where the patient is lying on their stomach on a special type of table that's actually open underneath, so it allows the x-ray machine to access the patient, but also allowing for the chest, the hips, as well as the thighs to be supported in addition to the face. We had several recent patients who've undergone previous spinal fusion operations. Unfortunately, they've developed a condition called flat back deformity, where their spinal shape requires a certain amount of curvature, which unfortunately, due to a previous fusion, no longer exists. So in order to achieve this, we have to make special cuts in the patient's spine, which are called osteotomies. In addition to doing this, oftentimes we have to remove their previous implants, the screws and the rods, and replace them with other patient-specific implants in order to allow us to get the right outcome.